So like I was saying before we went off, I was saying that prompt questions are also asked so that you can get possible responses that the interviewer also expects. So it's a way for just suggesting to the interviewee or whoever is responding to the question, the possible responses that you are expecting or you expect from them. So you can also come out with a suggestion. That is prompt questions. So if you ask questions, you think that the area the person is going has nothing to do with the answer that you are expecting, you can suggest questions to the responses to the person, and that becomes what? A prompt question. Is that okay? When the person is diverging or do not even follow what you are saying, the answer that they are giving to you does not relate to the questions that you have asked. You can prompt the person or alert the person by giving out suggestions, and that way can also help you to get all the information you have actually or you are actually looking for. That's about the prompt. But in the probe, we said I want further, I want expansion on the answers that the person has given to you. So you want further clarification, you want answers to be expanded for you to get what is happening. Then you use what? Probe questions. Other types of interview are informant interview and then focus group discussions. Informant interviews and focus group discussion is that the informant interview is somebody who has knowledge. He has so much knowledge in an area, and therefore all the information that you need, that person actually has the information. So you are going to focus on that person to get all the information that you want. So when you are going to do things of that nature, we say what? Key informant interview or informant interview, so that you can get all that you want. And the focus group is where you put people together, 6 to 8, and then you put the questions to them so that they can respond to it. You suspect that if you ask individuals, may not give you the answer, but when they are in group, when people are lying, others can put them on their toes. So you can also use focus group discussion. So we look at them one after the other. If you look at the informant interview, in an informant interview, the direction of the question or the direction of the interview and the areas covered are controlled by the what? The interviewee, the one who is responding to you. In that case, you don't know anything. It's like you don't know much in that area. And therefore, the one who has all the information is the one that you are rather coming to interview. So when you ask questions, you listen so that he will tell you everything from A to Z. So he directs, or he or she directs, has the knowledge on that. For example, if you are interviewing somebody about how exactly is about physician assistantship, somebody who has practiced for 20 or 25 years, you will not be able to ask questions and be directing the person. You allow the person to talk about all the things that he knows about that. Or somebody who is engaged in what? Drugs. You are not using drugs, so you don't know what it's involved to use drugs. You allow the person to tell you everything about drug use because they have the information on drug use. They have been using the drug all the time. So it is an approach which allows people's views and feelings to emerge. So they tell you their views, their feelings about it, and everything emerges for you to see. It is used when the researcher is interested in a particular situation or event. So when you are interested in a particular situation or event, and you don't have much knowledge about it, but you know that this individual has much knowledge about it, you use informant interview. Sometimes the police also use this in arresting criminals. Somebody who knows about these criminals will go and give that information to the police. Then the police also act on it to go and arrest people like that. However, when you are doing research, you identify individual who has information on particular issue that you are looking at. For example, if you want to understand female genital mutilation or female genital cutting, it is only somebody who has actually went through that particular practice who will be able to tell you the experiences, the pain, or everything that the person had to suffer with or have to live with for the rest of his or her life, or sorry, for the rest of her life. So clearly, it is only such individuals that have that knowledge can actually give you. So in that case, your interviewees are individuals who have been involved in that situation for so long. Somebody who have been doing that over and over again. So they have the information, and that particular information is what you are looking for. So they are the individual who have been there for so many years. They have the knowledge, they have the information, and they are likely to give you all that you want. That's about informant interview. In other words, you see some book, you see key informant interview. It's the same thing. Key informant because they have the information. They have key information about what you are looking for. So in some area, you see key informant interview, or in other words, you just see what? Informant interview. But beyond that is the second one, that is focus group discussion. It is a group interview on a particular topic with open-ended questions gathered by the researcher. So you can put teenage mothers together like 6. Normally you have to get 6 to 8, 6 to 10 sometimes. And then you ask question, what does it mean to be a teenage mother? So they'll begin, one person talk about her view. When you finish, another person will continue. And in that case, some people who even want to lie, others will say, no, that is not the case, especially when the thing is happening in their community. So it is also adopted when you think that you want to create some kind of an awareness, or you want to get information from people where you think that when they are in group, they are likely to share their views than engaging them individually, or when you think that it's difficult to get the information that you want when you are interviewed individually. It has the potential to create awareness and also empower participants, because there are people that if you interview them as an individual, they will not talk. They will not even give you the information that you want. But when they are in group, they will talk. That kind of shyness will be taken away. So they will be able to speak to you from A to Z. But when you meet them as an individual, you're asking questions, they won't mind you, they won't be able to talk. So when you identify people like that, you can also organize focus group discussion, why they sit in a semicircle or horseshoe formation, and you sit in front of them, you ask questions, and they respond to it individually. You want to ask a question? So for efficiency, members should not be less than 8, and the maximum should not, or most should be what, 12. By recently, we have even reduced that number to 6 to 10, so that you can have actual control over the group members. Because if you don't have control, others will be talking while others are also expressing their views. So it has been reduced down that you can start from 6 to 10, or in some cases, when you have control over the group, 8 to 12 is also accepted. Members they must have similar characteristics. When you want to organize a focus group discussion, you must ensure that all your members have similar characteristics. If they don't have similar characteristics, they don't feel comfortable to talk about the issues that you are discussing. For example, when you put adolescents together with their mothers and you're asking questions about womanhood or motherhood, do you think adolescents will talk? They will not talk because their parents are there. For example, you also put men and women together and you are discussing. In our typical villages, when men are talking, women do not talk. So you don't expect women to talk when you put them together. You not get the information that you want to get from women. It is only when in our modernized societies or typical modern urban setting that you see women making a point even when men are there. But in typical villages, when the husbands talk, the women or their wives do not talk. So when you put them together, you're asking questions. It's only men that to talk, women will not talk. So we are saying that when you are creating groups to undertake focus group discussion, make sure there's a similarity among all the group members. They are all mothers, fine. They are all fathers, fine. They are all nurses, fine. They are all doctors, fine. But when you go and put doctor there, cleaner there, orderly there, the orderly will not talk. The nurses will talk, the midwife will talk, the doctor will talk, but other group of people may not talk because they are looking at socioeconomic status or their level in society. They will tell you, who am I? When doctor talk, I should challenge him. Who am I? When nurses talk, I should challenge him or say that otherwise. Who am I to talk when the midwife said this? When physician assistant said this? I am only a common cleaner. But when you put all the cleaners together, they will talk, they will express their views. You'll be surprised about things that they know about in the hospital. So what we are simply saying is that when you want to do this, make sure you have similar characteristics of people who have the same level of education, they have the same job, they are mothers or fathers, so that they will feel comfortable to express their views. But if you don't do that, you don't get the information that you are looking for. Then if you look at the focus group characteristics, you must have homogeneous characteristics. When you have the homogeneous characteristics, that all the members have the same background, then it facilitates communication. If they all speak English, they all speak. My internet is falling again. Then it facilitates communication because they all have the same background. Nurses, they are all nurses, they understand what is going on, and that is easy for them to understand, and it facilitates your communication. Also promote an exchange of ideas and experiences among them. Gives a sense of what? Safety in expressing their concerns, because they know that they are all at the same level from the same background. So they don't feel any fear that somebody is going to say otherwise. May also result in what? In a lot of what? Similarities. May also result in a lot of what? Similarities, in a sense that they're all coming from the same background. But when you have homogeneous characteristics, the members have different background, therefore can stimulate and enrich the discussion. If you have midwife, nurses, doctors, pharmacists coming together, then they can give you various perspectives from their backgrounds. So it enriches the discussion. The pharmacists will come with their ideas, nurses will come with their ideas, midwives will come with their ideas, and doctors will also come with their ideas. And two, may risk power imbalances. That's another challenge, because the nurse may feel that if the doctor talks, there's no need for me to talk. When they are talking about those things, and the doctors, if the doctor talks, who am I as a nurse to talk? If a doctor talks, who am I as a midwife to talk? So it will also bring what? Power imbalances. In some cases too, some members of the group, they think that they are above others. So when they talk, nobody should speak. And when they speak, nobody should talk. So when that happens, you also engage, or you also observe what we call what? Power imbalances. It happens when socioeconomic status of the individual who are in the group, or their levels in the society, even though we are saying they should come from various backgrounds, but there are people who has more power than others that can also influence. That's what we talk about. Power imbalances can also lead to lack of what? Respect for opinions expressed by others. For example, imagine putting nurses, midwife, PAs together, and the orderly is talking. Do you think they will listen to the orderly? They will not listen to him or her, because they think that he doesn't have any knowledge, and therefore they won't take whatever he or she is saying serious. So there was sometimes he bring what? Disrespect. They don't respect the opinion of those people, and it can also lead to a dominant participant destroying what? The group process. There is somebody that sometimes when you ask questions, they want to respond at all costs. Even when others are making points, they'll shut them down. When you have people like that from different background. So those are the factors that you have to consider anytime you want to organize focus group discussion. This is an example of what we are talking about. You see the people they're asking the question. They are facing the community. Typical setup. Their pets are with them in the village, are sitting under the tree. We have them asking questions, and then community members are responding. Even those who are not part of the discussion, they are sitting behind just to listen to what is happening. You know our villages already. Everybody wants to listen to what is happening. So those who are not invested to, they sat behind the people and they were listening to what is ongoing. So this is a typical group or in a village where focus group is taking place. Any question before we look at the advantages?
Hello, sir.
Yes.
Yeah, I keep on losing your internet feed, but let me ask a question. You said that when the interviewer is asking a question, uh, there will be power imbalance.
Imbalance, yeah.
But is it when you ask the question? But is it not? Yes, is it not the responsibility of the interviewer to throw the question to specific group of people than leaving it for everybody to answer the question? So if you have nurses, you have doctors, when you direct the question to the doctor, you let the doctor answer, then you direct the question that must go to the nurse so that you can control the discussion, the interview.
You know, have you been to our typical villages before? You even direct the question to this specific person, but somebody will hijack that. Because of their level in the community, they want to show off. Or they are the most influential people in the community. So whatever I say, they are going to hijack. So it's not that you did. However, there are people like that in our communities. They want to be seen everywhere. So that creates the power imbalance. They think that they are ahead of everybody. So that is the case. It's not that you are not directing the question. So that's why one of the disadvantages that if you, the interviewer, you don't put your feet down, you don't control the group, you not get any information. So you must also prepare to control the group or the group members so that you can get the information that you are looking for. Now, if you look at the advantages, they are here. The focus group discussion is an efficient method for qualitative data collection. It's one of the ways that people use to collect data because they think that if you go to ask or interview people individually, it will waste your time. By using 2 hours, you have gotten information from 8 or 10 people at a go. So they prefer focus group discussions to individual interviews. It is relatively less expensive and flexible because you are organizing interview for 8 or 10 people at the same time. And it is also flexible. As you ask questions, somebody who is not ready now, you can redirect the question. And when they are ready, they respond to it. And sometimes if they don't have ideas, they move on to the next level. Participants are also empowered and able to make comments in their own words. You have empowered the members of the discussion to make any comments that they want to make in their own words without any challenge, without any problem. So contribution can also be encouraged from people who are reluctant to be interviewed individually. So when you have focus group, it also helps you to get information from individuals who actually feel reluctant to be interviewed individually. But in a group, they will feel comfortable to speak their mind. But the disadvantage are also there. Only few questions can be asked. Because, for example, people are many. If you have 10 people in a group or 12 people in a group, by the time they finish answering one question, the time is gone because we are giving time to every individual to respond to the question. Somebody may use about 3 minutes to respond to the same question. Somebody may use 5 minutes, 6 minutes. So by the time they finish answering one question, 1 hour is gone already. By the time you ask the second question, 2 hours is gone already. So sometimes you'll not be able to ask so many questions when you are doing what? Focus group discussion because of the numbers. It also requires experts to facilitate the group. If you don't have the expertise to facilitate the group, that can also destroy the interview in a sense that these individuals are going to hijack the discussion, as I said earlier. Conflict may also arrive. Somebody will say this, the person will say you are lying. Somebody will say this, and then if you don't take that, they are going to report things that you discuss will be reported in the community. Do you know when we had this interview? Do you know this what somebody said about you? So that also brings what? Conflict. Confidentiality may become a problem or become a problem among the participants because you are sharing your experience or your values or your emotions or feelings. So whatever you are saying, somebody will take it and go and say it outside that this is what you have said. So the information that you are giving out confidentiality is no longer there. Meanwhile, we are saying that you must ensure what? Confidentiality. So when you are using focus group discussion, you must also be mindful of what? The issue of confidentiality, which also breach ethical issues. Because the information that they are sharing to you, everybody is going to listen to whatever their friends are saying. In future, in the community, when there's a fight, somebody can say, hey, you, when we had a meeting, you said you have a caused abortion before. So they begin to insult you. So confidentiality is limited. So when you want to use focus group, you must look at the topic that is not so sensitive that people may not be willing to tell exactly what is the information that they have. Result cannot be generalized. And this is what generally to all the qualitative research. You cannot generalize the result that you are getting from focus group discussion because they are not representative of the entire population or the total population. So you cannot also generalize the findings from this kind of discussions. Any questions? Any further questions? Any further question on that we have discussed so far?
No, sir. From this side, I don't know about that.
If there are no questions, I will wish that we end it here on the research. If you have time, we can look at the health system, but if you don't have time, we can do that tomorrow so that we close here. So it's over to you. We can close here and continue tomorrow. Or we spend some 30 minutes to look at something in the health system. Otherwise, we'll continue tomorrow and look at the health system and health promotion.
We'll continue tomorrow.
It's almost 8, so we can close and so that tomorrow we continue. Yeah.
Yes, sir.
Because
yes,
we just have our 10 minutes.
Yes, sir. Let's meet tomorrow.
Okay. All right. So if there are no questions, we'll end our lecture here and then probably we'll continue tomorrow.
Thank you, sir.
Yes, sir. Thank you, sir.
Right. Okay. All right. Then good night.
All right, sir. Good night.